Hi students, today we'll see about wrist joint anatomy. Okay, wrist joint and the joints of hand anatomy. Okay, in this first feature, in the picture representation for the lower end of the radius and the ulnar bones are mainly for articulates with the proximal row of carpal bones. Okay, scaphoid, lunate, and tricutal bone. These are bone articulates with the formed by wrist joint. Okay, this wrist joint is also called as radiocarpal joint. Okay. Second, the wrist joint synonyms. What are the synonym? Or radiocarpal joint. Wrist joints are also called as radiocarpal joint. Okay. Then type of joint is called as synovial joint. Okay, synovial joint. Why it is called synovial joint? The synovial joint is in the synovial membrane. This synovial membrane is present on the joint surface. Okay. This membrane is produced by the synovial fluids. Okay. This synovial fluids is mainly for the avoid the friction between the two bones. Okay. This mainly for shock absorber for the synovial joint surface. Okay. So also called as type of joint synovial joint. Okay. Then the subtype or variety of the joint is the ellipsoidal variety. Ellipsoidal variety. Okay. Then biaxial joint. Okay. Then wrist complex is called as radiocarpal joint or midcarpal joint. Okay. Then articulating surface of wrist joint mainly for upper surface and lower surface. The upper surface is the distal end of the radius and articular disc of the inferior radio-ulnar joint. Okay, in distal end of the radius and the articular disc of the inferior radio-ulnar joint. Okay, then the lower articular surfaces of the scaphoid, lunate, and tricutal bone. Okay, scaphoid, lunate, and tricutal bone. Okay, then the proximal articular surface forms on ellipsoidal concave surface. The proximal articular surface forms an ellipsoid concave surface in which fits the distal ellipsoid convex surface. Distal ellipsoid convex surface. Okay, this is called the articulating surface of wrist joint. Then the ligaments. What are the ligaments attached to the joint? Okay, the mainly for four ligaments are capsular ligament, palmar ligament, dorsal ligament, and collateral ligament. Okay, you see about this diagram, the brown color shade is called as palmo-radiocarpal ligament or wrist joint. The mainly for this surface. This surface is a palmar. This is for dorsal. This palmar region, the center of the region. This are radius bone is present on this radius bone. This is a carpal bone. This entire radius and ulna and carpal bone covering this ligament for the brown color ligament. This is called as palmar radiocarpal ligament. Okay. Then the green color in the side of the side is the green color name is called ulnar collateral ligament. Okay. This is present on this my hand seen about this surface. The little finger side. This is for ulnar stellate process to the carpal bone, the distal row of the carpal bone. Okay. This attached to this ulnar collateral ligament. This ligament mainly for the green color marking. This is a ulnar collateral ligament. This purpose of this ligament mainly for it's maintain the medial stability of the joint. Medial stability of the joint. Okay. Next ligament, the yellow color. Yellow color ligament is the thumb. This is the word thumb. This thumb, the below the part is a stellate process. Stellate process. This stellate process to the entire this carpal bone. Stellate process to the carpal bone area is mainly for attached to this radial collateral ligament. These ligament are yellow color marking. Okay, radial collateral, ulnar collateral, then palmar radiocarpal ligament. Then in the either side is a dorsal surface, dorsal or posterior surface. This surface mainly for radius ulnar and carpal bones attached with the same brown color as the dorsal radiocarpal ligament. Okay, the one ligament is missing of this structure, or this is capsular ligament. This capsular ligament mainly enters to the anterior and both joint anterior and posterior, which covered with this the joint. Then capsular ligament encloses the joint and is attached above to the distal end of radius ulna and below to the proximal row of the carpal bone. ஓகேங்களா, அது radius ulna and proximal row of the carpal bone இங்க கவர் ஆகிக்கிறது தான் வந்துட்டு capsular ligament. Then synovial membrane lines the capsule and is attached to the margin of articular surface. Lines the capsule and is attached to the margin of articular surfaces. The joint cavity does not communicate with the joint cavity does not communicate with the that of distal radio-ulnar joint or with the joint cavity of intercarpal joint. The joint cavity does not communicate with the distal radio-ulnar joint or with the joint cavities of the intercarpal joint. Okay. In this picture, we will show about the blue color marking. Okay, that is indicate the intercarpal joint. Intercarpal joint. This area not communicate with the joint cavity. First point. Then second point is that the radio-ulnar joint. Above the diagram, first the radius and ulnar bone, the center where the gap is present. That gap is called does not act on the joint cavity. This area and intercarpal area. This area does not communicate with the joint cavity. Okay. Then pre-stellate process. Pre-stellate process. Okay. This is the ligament: palmar radiocarpal, palmar ulnar carpal, dorsal radiocarpal, radial collateral, and radio ulnar collateral ligament. Okay, students. These are, we will see about, these are the structures of joint, the wrist joint, seen about type of the joint, type of variety, then articular surface, then ligaments. These are the seen about this class. Okay. Next class we will continue the relations of the joint. Okay. Thank you. Good afternoon, students. Today I will see about joints of hand. Okay. Last class see about wrist joint and mid-carpal joint is seen about. This class will about joints of hand, entire hand. Okay. First joint is the mid-carpal joint. Okay. Mid-carpal joint, where it is articulation? Articulation between the proximal row and distal row of the bone, that is called as mid-carpal joint. This mid-carpal joint is a synovial joint. Also the synovial joint, that is variety is a ellipsoidal variety. Then is a intercarpal joint, the plain synovial joint, that is between the individual carpal bones. Example, like in the representation of the diagrammatic representation, the blue lines are called as the intercarpal joint. Then we will go for carpometacarpal joints. That is also called a CMC joint. The first joint, that is this joint form, that is a CMC joint, carpometacarpal joint. Carpometacarpal joint. Okay, carpometacarpal joint. And the first joint is saddle variety. This joint is a saddle variety. This joint 2 to 5 joints are the plain joint. 2 to 5, and these are joint plain joint. This is saddle variety. Okay. Then intermetacarpal joint. Okay. This is the intermetacarpal joint. Okay. These joints intermetacarpal joints. This is metacarpal, is carpal. This surface is called as intermetacarpal joint. Okay. Then there is also plain joint. Then metacarpophalangeal joint, that is also called metacarpio. This joint, this is the metacarpophalangeal joint. Then this is for interphalangeal joint, proximal interphalangeal joint and distal interphalangeal joint. Distal phalangeal and proximal phalangeal, metacarpophalangeal, intermetacarpal. Okay. Then midcarpal, then wrist joint. Okay. This is metacarpal joints also the ellipsoid joint. Intermetacarpal also called for plain joint. This is called plain joint. Intermetaphalangeal joints also called as hinge joint. Okay. Then first joint is a first carpometacarpal joint. Okay. This first carpometacarpal joint is a synovial joint. Variety is a saddle variety. Okay. This the round picture the round marking is the first metacarpal bone articulates with the distal row of carpal bone trapezium. The first carpal bone is articulates the proximal surface of base of first thumb is articulates the distal row of carpal bone is called trapezium. These are structure articulates formed by first carpometacarpal joint. Okay. Then there's a lot of ligaments surrounding this joint. What are ligaments surrounding this joint? First is a capsular ligament. This capsular ligament either anterior, posterior, all directions stabilize the joint. Then anterior ligament. This is for anterior ligament. This is for posterior ligament. Then lateral ligament. Anterior, posterior, and lateral. The 4 ligaments are present in the first carpometacarpal joint. Then relations, movements, and upper anatomy. Okay. The common upper anatomy in this condition is decoherent tenosynovitis. Okay. These X-ray findings will show about these features are seen. Okay. First is here about first marking distal. You go through distal to proximal. First line is the radius. Lateral side present in the radius bone. That bone is the findings of X-ray radius. That opposite direction is about the ulnar bone. Okay. Then in above dash will go for ulnar bone is mainly superior for the head of ulna. Then either laterally to the ulnar styloid process. Okay. Then opposite side the radius bone below above the proximal direction radial styloid process. Okay. In the radial styloid process above the structure is called as scaphoid bone. The scaphoid bone above the line is called as trapezium bone. Okay. Then the trapezium bone next bone is called as trapezoid bone. Okay. Then the trapezium bone below the bone is called as base of first metacarpal. Okay. Then in this side the ulnar styloid process above the bone is called as lunate. Scaphoid after the bone is a lunate. Then after the bone is a tricutral. Then attached to the tricutral bone is a pisiform. Below the bone is called as a distal row hamate. Then hook of the hamate. Then base of the fifth metacarpal. These are the structures seen of the X-ray findings. Okay. In clinical anatomy of the hand, mainly for rheumatoid arthritis. Okay. Ganglion. Aspiration done from the posterior surface between tendon of extensor pulsus longus and extensor indicis. Then immobilization is the optimal position for 30 degrees of dorsiflexion. The clinical anatomy of the fracture of the scaphoid is caused of fallen outstretched hand. This position. Fallen outstretched hand. Fallen of this position in the hinge on the fractured scaphoid bone. Then causes for the signs and tenderness in the, and that is in this position. The thumb backs to extension of the thumb. We keep on the dimple, form a dimple. This dimple is called the anatomical stuff box. This area is present on the pain. Okay. Then complication is the avascular necrosis and arthritis. The Cooley's fracture. The fracture of the lower end of the radius. Lower end of this is a radius bone. This bone is fractured. There is a distal fragment is displaced posteriorly. Then fall on the outstretched hand. This injury is happened. Mainly signs of the dinner fork deformity. Thank you. Any doubts?